Hello everyone. I am an overseas trained doctor, recently started working in Western Australia. One of the first steps I had to complete was getting my vaccinations up to date for employment. In this video, I will walk you through what was required, how I got them, any costs involved, and a few tips I wish I knew earlier. So, before starting the employment, they sent me a document to be filled that is called the N10 Pre-Employment Health Assessment. They have shortened it as PEHA. So, that form should be filled. So, let me take you through the form. First, it says the appointee details. So, we have to write our family name and the given names according to the passport. Then they ask about the basic details like the gender, date of birth, country of birth, and the current address. That should be an Australian address. And our email address, then contact numbers, the position that we applied for. And then they ask about the manager's contact numbers, their details, and the site or the program that we are employed in, including the length of contract. So once we are done that, it's another part to be filled about the previous employment. Like I've been working back in my home country, so I included the positions and the employer that I worked back in the country. Next comes the health questionnaire. Then they're asking me about my medical conditions that may be aggravated or could reoccur due to the type of work which I'm applying. Then you have to tick yes or no for that. And again, they're asking, have you had more than 2 weeks off work because of medical condition or injury or been hospitalized in the last 2 years? Are you currently being treated by a doctor or health professional for this medication condition or injury? Have you previously made a claim for motor vehicle injury, disability, or invalidity? So, if you have answered yes to any of the above questions, you have to give the details about that. Next, are you currently taking any medication that may affect your ability to undertake the duties of the role you are applying for? If yes, you have to give the details. Do you have any job-specific needs or requirements? Are there any reasons that you may not be able to physically or mentally perform the duties of the role that you are applying for? Answer yes or no, and if you have answered yes, then you have to specifically give the details why you have answered yes. Then it's the weight and the height. And do you participate in sports or exercise is another question that we have to answer. Next comes the health questionnaire. Then you have to answer whether you are having or have you ever had any of the following conditions. There are a list of conditions. I'll just rush you through. It may be the eyesight defects or disorders, color blindness, hearing loss, any skin conditions, allergies, hay fever, asthma, then stroke, paralysis, hypertension, any cardiac conditions, then neck, back, shoulder, hip, or any injuries, disorders, arthritis conditions, any cancers, sleep disorders, any mental health conditions, migraines, epilepsy, thyroid disorders, and there's a huge lot that you have to answer whether you are having them or not. And if you have answered yes to any of the questions, then you have to give explanations for those. So my advice is to be honest. Give the accurate details, and if those illnesses are not impairing you or if they are not preventing you from doing the job, then that will be totally fine. Okay, then they are asking about the treating specialist or the GP, including his contact details if you are getting treatment for any of the above conditions. Okay, then you have to answer a few questions about the infection risk assessment. First question, will you be working in patient areas within a hospital or community setting? Does your new position involve direct contact with patients or diseased persons? Are you likely to have contact with blood, body fluids, or biological specimens? Will you work in a sterilization service department? Will you have close or physical contact with soil, sewage, or feces? So answer those questions depending on the role that you are taking. Like for example, if a doctor is supposed to work in a surgical theater, then you have to answer yes for the question that will you work in a sterilization service department. So it will be like that. And then you have to declare the given information and sign it with the date. Okay, next comes the most important information about it. They're asking, have you worked or been patient in a residential or healthcare facility outside Western Australia in the past 12 months? Since I have been working outside Western Australia, then I have marked as yes. Then, have you been screened for MRSA in Western Australia within the last 12 months? I answered no. Okay, then I'll tell you the importance of this question, because for my specific position, I had to undergo clearance for MRSA. So since I have answered no for this screening question, they actually arranged me an investigation, the nasal swab and a throat swab, to screen me for MRSA. And then there's a screening for tuberculosis as well. It asks which countries you have lived or worked in more than 6 months, other than your country of birth. Have you had contact personally or at work with somebody who has been diagnosed or treated for TB? Have you ever had TB? If yes, have you been treated? Then, have you had a MAN2 or HEAF or quantiferon test in the past? So this I will answer, because for the visa medical examination, I had to undergo quantiferon test for tuberculosis, which came as negative. So therefore, I answered yes to the question that, and then put the date of the report and the result as negative. And then they further ask about the BCG vaccination, and have you had chest x-ray recently for any reason? Even that I had underwent during my medical examination. So then I answered yes for that question as well. Then asking whether we are Aboriginal or Torres Strait Islander. And then the date of arrival in Australia. So after you have filled those, there are some questions about the immunization, assessment and the requirements. So it's very important that you answer honestly to these questions. First one is the hepatitis B. They're asking whether you have had a blood test to confirm your immune status. Then I have had an assessment, so then I marked yes. And then I have to give the result as well. I have attached the result sheet, the lab report, with this email and sent back to them. And also for the hepatitis A immunity status, the varicella, in varicella or the chicken pox, they are asking whether you have ever had chicken pox, or else if you are vaccinated, whether you have had blood test to confirm your immune status. I had neither chicken pox nor I have had done blood test to confirm immunization status, so I answered no to that. And after evaluation, their feedback for me was that I should get the chickenpox vaccine. And then for the mumps, measles and rubella, have you had a blood test to confirm your immune status? I haven't had. Then I answered no. Similarly, they have arranged me a blood test for the assessment of immunity level for mumps, measles and rubella. And another thing is the diphtheria, tetanus and pertussis, or the whooping cough. Have you had an adult booster for tetanus and pertussis in the last 10 years? I haven't had, so I answered no. So similarly, they have arranged me a vaccination for that. Next comes the influenza vaccine. have you had flu vaccine in the winter season or the year? I haven't had, so I answered no. So according to these details, they said that they recommended me actually to get the varicella vaccines and the adult pertussis and tetanus vaccine with influenza vaccine. So altogether I got 3 vaccinations, and back in the country I have had mumps, measles and rubella vaccinations, but I haven't checked my immunity level. So they offered me to check the immunity level, which the report came as positive immune status. Then they didn't advise me to get the MMR vaccine. So that's why the importance of answering these questions properly. And if you don't have evidence, just don't worry. They will anyway be checking the immunity status with a blood test. And then comes the COVID-19 vaccination status. Then I have had all 3 COVID vaccinations, and I have attached the vaccination certificate that was given by the government. And then it was like that. So they also provide COVID-19 vaccination as well. So if you haven't had enough boosters, they will recommend you to get the vaccination. Okay, next comes the bloodborne virus screening. That is for the medical, dental, midwifery and nursing staffs. So they are asking, are you required to perform exposure-prone procedures in your new position? If yes, have been screened for bloodborne viruses in the past 12 months. That also been done already by the visa medical examination. So then I answered yes and attached a report with the email. And then comes the declaration and signature, where you have to write your name, put the signature and the date. So that is about the N10 form. So once you have completed the form, you have to email it to the infection prevention unit with the reports of your serology if you have any, and then they will analyze the report and give the recommendations before you start working, the mandatory vaccinations or the mandatory screenings that you have to do. So in my case, I had to do the MRSA clearance and to get the antibody levels for mumps, measles, rubella, chickenpox. And so they gave me a voucher. So I printed it and went to the nearest collection center. Those are called the Path West in Western Australia. So I went there. After I gave the receipt, they made some clarifications online and then collected swabs from my nostrils and throat for MRSA screening and collected blood for the serology screening. Once the results are available, the laboratory itself will forward the results to the infection control unit, and then they sent me another email asking me to get the vaccinations, and I was asked to make an appointment online with the nearest vaccination center or the available vaccination center, and I had to go there to get all my vaccinations done. So once I got all the vaccinations, then I was declared as fit for the employment, and thereafter they declared me as safe to commence employment and to proceed. So one of the main reasons that I really wanted to do this video is that I have seen many international medical graduates worrying too much about their vaccination status and to get their antibody levels checked, which are relatively costly in the countries. However, not all the reports done back in our home countries will be accepted in Australia. So they will invariably be doing another serology assessment as well. So don't worry too much about the vaccination status. If you can get it done, it's always good to get it done. And if you have the records, please keep them with you and bring them when you come to Australia. But do not worry too much about completing all the recommended vaccines before you come to Australia. Hope this information helped you. See you with another video. Bye.